Agent. It is produced by the bacterium Vibrio cholera. It is a gram-negative bacillus which has a short incubation period that goes from 1 to 5 days. However, sometimes from day 1 to day 10 it can be asymptomatic, but the bacteria is already present in the feces of the infected person.
Transmission mode. Cholera disease is transmitted by food or water contaminated with the bacteria which live in the feces of the human being. It is easily transmitted from person to person when adequate hygiene habits do not exist or in regions of poverty and scarcity.
Symptoms of cholera can begin as soon as a few hours or as long as 5 days after infection. Often, symptoms are mild, but sometimes they are very serious. About 1 in 20 people infected have severe watery diarrhea accompanied by vomiting, which can quickly lead to dehydration. Although many infected people may have minimal or no symptoms, they can still contribute to the spread of the infection.
Either for a hospitalization patient or for an outpatient, the procedure will be carried out in the same way, and the patient will be instructed to follow the following steps. First, have a collector bottle given by the health personnel. 2. When you feel like going to the bathroom, wash your hands with soap and water, and if you want to put on gloves to avoid more contamination when collecting the sample. 3. The collection bottle where for the deposition enters directly without coming into contact with the toilet or vanilla. 4. Clean the contour of the bottle and cover it, shaking that there's it no leak. 5. Label the bottle with complete that and put it in a bag or plastic, insulate it from the medium. 6. Wash hands again with soap and water. 7. Approach the health point where your sample will be analyzed, or if you are in hospitalization, inform the health staff and it's taking care of the patient.
For the adequate analysis of the sample, it is necessary to have the following elements: hat, protective glasses, mask, lab bat, and gloves. Before the analysis of the sample, it is necessary that the sample has passed through an adequate transport and storage to avoid crossings of diagnosis. First, verify correctly labeled data in the collection bottle, that there is a minimum volume of 5 to 10 milliliters if the sample is liquid, and also that it has less than 2 hours after collection if no refrigeration was done. 2. Separate the necessary measure and isolate it in a petri dish for its cultivation, adding some gel or solidifying as the nutritive agar. 3. Add gram stain to determine the type of bacteria. 4. Carry out initial observation to verify the classification. 5. Wait 18 to 36 hours for there to be a minimum of bacterial proliferation and perform observation with the microscope to obtain a partial diagnosis. Sixth, start antibiotic sensitive test. Seventh, the final and definitive result will be given after 5 days of bacterial culture.
Treatment. The initial treatment is rehydration, trunk, oral rehydration salts, or intravenous fluids with large electrolyte supply depending on the degree of dehydration in which the patient is. After obtaining the results of the culture, the doctor will administer the appropriate antibiotic to fight the bacteria and decrease the diarrhea.
Promote the washing and sanitation of hands among the entire population. Perform proper handling of food. In populations with vulnerable conditions, improve water sanitation. In endemic areas, make use of oral basins currently available.
It's Contract Productions. Hey.